This lecture is going to examine a couple of the drugs that are used for the treatment of urinary incontinence. Pretty simple learning objectives, just basically how do they work and what they are. Understand that in terms of the physiology, we're looking at kind of two processes in terms of urine storage and urine evacuation. I really like these two diagrams. These were taken from Harrison's Internal Medicine Review, if I'm not mistaken. But understand that in terms of urine storage, we're looking essentially at sympathetic neurotransmission, particularly norepinephrine and epinephrine binding to alpha and beta receptors. But for urine evacuation, we're looking at cholinergic nerve activity, particularly with muscarinic type 2 and muscarinic type 3 cholinergic receptors. And so, of course, the vast majority of the drugs that are out there that can treat urinary incontinence tend to be M2 and M3 specific antagonists. And so those drugs are listed right here. Some of the newer drugs, particularly derafenacin and others in that category, are specifically M3 antagonists. And so they have a much higher selectivity to M3 than M2. The rest of them have varying selectivities to either M2 or M3. There's a new group of drugs that are out there that are beta-3 agonists, and that drug mirabegron is the generic name, is listed there. So oxybutynin and all of the other cholinergic antagonists that we just looked at on the previous slide are all antagonists on the M2 or M3 receptors on the detrusor muscle. And basically, from a clinical standpoint, we're going to reduce the number of the incontinence episodes as well as the volume that's lost during each of those. So the clinical effect here, we're going to see relaxation of the bladder smooth muscle. We'll see an inhibition of involuntary muscle contractions on the detrusor itself. In terms of the side effects, relatively mild, but because these are anticholinergic drugs, you can often see systemic anticholinergic toxidrome side effects associated with oral use of these drugs. And so to kind of combat that, we've got more refined chemistry. As I said earlier, we can see the starting production of M3 specific agents. And some of the older drugs, such as oxybutynin, are now delivered in a transdermal delivery patch system. And that kind of basically goes around the systemic effects of these drugs. And so the systemic effects are similar to the anticholinergic effects that we'd already talked about. And so I like this chart because it nicely reviews what we learned last year, the side effect versus the clinical outcome. And so higher doses of some of these urinary incontinent drugs can produce increased increased pupil size, resulting in photophobia, reduced visual accommodation, resulting in blurry vision. All of these you're familiar with. And so the main clinical effect here that we're really going for is reduced detrusor function, and that's going to help with urinary retention. There will be some GI effects as well. The beta-3 agonists are essentially being developed, or were developed, I should say, they're FDA approved now, for urgency associated with urinary incontinence, as well as increased frequencies. Now, when you activate these beta-3 receptors, you can produce relaxation of the smooth muscle, and you can increase the bladder capacity. Side effects are listed there. Hypertension, UTIs may be a little bit more common. Dry mouth and headache are commonly reported. So these are the main drugs for urinary incontinence. And so we will continue on with other drugs for this particular case. Thank you.